Most people think that when something serious happens inside the body, there will be pain, fever, or some dramatic sign that something's wrong. But the truth is much more dangerous. When your body is in real trouble, especially with cancer, it often starts off whispering. A little change here, a strange feeling there, a new sensation that's easy to brush off. And that's exactly why so many people don't catch it early. They tell themselves it's probably nothing or I'll deal with it later. But later might be too late. Cancer rarely screams in the beginning. It slips in quietly, masks itself as something normal, and takes its time spreading. And when the pain finally comes, it might already be stage 3 or 4. That's why awareness isn't about panic. It's about being proactive. It's about giving yourself the best chance to stay ahead of something that hides in plain sight. In this video, I'm going to walk you through 13 signs your body might be giving you right now.
Some are obvious. Others are so subtle you'd never imagine they could be serious. But knowing them could save your life or the life of someone you love. And before we dive in, if you care about your long-term health and want reliable, science-based advice on how to detect early symptoms, improve your lifestyle, and prevent serious diseases, hit that like button and subscribe.
YouTube needs to know this type of content matters, and with your help, we can get it in front of people who might desperately need it. Let's start with the first silent warning sign, the kind that many people actually celebrate without realizing it's a red flag. Losing weight without trying might sound like a dream come true, especially for those who've struggled with extra pounds for years. But when the pounds start dropping and you haven't changed your diet, exercise, or routine, that dream can quickly turn into a warning sign. If you've lost 5, 10, or more pounds in a short time without meaning to, you need to take it seriously. Unexplained weight loss is one of the most common early signs of certain cancers, especially those that affect your digestive system, like pancreatic, stomach, esophageal, or even lung cancer. What's happening is that the tumor interferes with your body's ability to absorb nutrients. It hijacks your energy supply, forcing your system to burn through muscle and fat to feed the cancer cells. And the worst part? Many people think it's just stress, age, or a temporary phase. They celebrate the weight loss, not knowing that something dangerous could be growing inside them. This becomes even more concerning when weight loss comes with a drop in appetite or extreme fatigue. You wake up tired, feel weak for no reason, and everyday tasks start to feel like a challenge. It's your body's way of saying, I'm using everything I've got just to function. So ask yourself honestly, have you lost weight recently without trying? Has your energy been off even though you're sleeping? If the answer is yes, don't brush it off. Don't wait for it to get worse. Get checked, because the earlier you catch it, the better your chances of stopping it in its tracks. Everyone feels tired now and then. That's normal. But there's a different kind of exhaustion, the kind that doesn't go away with sleep, that lingers even after a full night of rest, that makes every step feel like you're walking through thick mud. This isn't the tiredness that comes after a long day at work or a poor night's sleep. This is deep, unexplained fatigue that just keeps coming back, no matter what you do. And it could be one of the earliest signs of cancer. When cancer cells begin to form and grow, they demand a huge amount of energy. Your body, in turn, has to work overtime to fight them, even if you don't know it yet. That hidden battle drains your strength, leaving you feeling like your battery is always at 20%, even on your best days. You might find it hard to concentrate, your muscles might feel weak, and even small tasks like cooking or walking upstairs suddenly feel overwhelming. And yet, because fatigue is so common in modern life, most people don't think twice about it. They blame work, stress, the weather, aging. But when you're tired for weeks or months without a clear reason, and that tiredness starts affecting your daily life, it's time to ask the hard questions. Is something more serious going on inside me? Don't wait until the fatigue gets worse or turns into something more obvious. By the time cancer speaks loudly, it's often already far along. Catch it while it's still a whisper. If your body feels like it's constantly running on empty, it's time to listen. Your skin is a map of your internal health, and it often speaks before any other part of your body does. We tend to worry about wrinkles, dryness, or acne, but we rarely think of new spots, moles, rashes, or discoloration as something serious. That's a dangerous oversight. If you notice a mole changing in shape, color, border, or size, or if a new one appears out of nowhere, that's not just cosmetic. It could be one of the earliest signs of melanoma, one of the most aggressive forms of skin cancer. But the warning signs don't stop at moles. If you experience chronic itching in the same spot, patches of skin that bleed or won't heal, or thicken areas that feel different from the rest of your skin, it's time to take a closer look. Even your nails can send signals. Sudden dark streaks, thickening, or unusual growth should not be ignored. Most people delay seeing a doctor because it's painless or because it looks fine, or they assume it's just a minor infection or irritation. But when it comes to skin-related cancer, early detection can be the difference between a quick removal and a life-threatening diagnosis. Don't assume every spot is harmless. And don't let vanity or denial keep you from investigating. Your skin is trying to talk to you. It's on the surface for a reason. Check your back, legs, arms, scalp, places you don't usually pay attention to. And if you see something new or strange, get it looked at. One glance could save your life. Your body knows how to control bleeding. So when you start seeing blood in places where it doesn't belong, even in small amounts, it's a sign you should never ignore. If you notice blood when you brush your teeth, cough, go to the bathroom, or even between menstrual cycles, your body is trying to tell you that something isn't right. Sometimes, yes, it could be a minor issue, maybe a gum infection, hemorrhoids, or a mild irritation. But if the bleeding repeats or shows up without any clear reason, it could be something much more serious. Cancers of the colon, cervix, bladder, or lungs often present with unexplained bleeding in the early stages. And because it's not painful, people usually dismiss it. They wait. They hope it stops. They tell themselves it was just that one time. But cancer doesn't wait. Blood in your stool doesn't always look bright red. It can be dark, almost black. Blood in your urine may be just a pink tint. A persistent cough with blood-tinged mucus is a huge red flag, even if you don't smoke. And if you experience postmenopausal bleeding or spotting between periods, especially if you're over 40, don't write it off as hormones. Your body has rules. Bleeding outside of injury or menstruation breaks those rules. Listen to that. You don't need to panic, but you do need to act. A simple exam could give you peace of mind, or catch something early while it's still treatable. Don't wait for the bleeding to get worse. Speak up the first time it happens. We all get stomach issues from time to time. Maybe you ate something heavy, you're stressed, or your schedule is off. But when digestive symptoms become your new normal, when bloating, acid reflux, frequent indigestion, nausea, or changes in bowel habits show up for more than 2 weeks, that's your body waving a red flag. It's not just about what you ate. Ongoing issues like constipation that won't resolve, diarrhea that keeps coming back, or feeling full after just a few bites of food could be signs of gastrointestinal cancers like colon, stomach, pancreatic, or esophageal cancer. These types of cancer often start quietly, with subtle symptoms that mimic harmless conditions like irritable bowel syndrome or food intolerances. That's what makes them so dangerous. People dismiss the signs for months. They take antacids, change their diet, or just wait. Meanwhile, the real problem is growing. You should also pay attention to the shape and color of your stool. Pencil-thin stools or dark, tar-like ones can point to blockages or bleeding inside the digestive tract. If food isn't sitting right, if you feel nauseous without cause, or if you've lost your appetite for no clear reason, those are all messages from your gut. Your digestive system is incredibly sensitive, and when it's off for more than a few days, it's not overreacting. It's warning you. You don't need to panic every time your stomach feels weird, but if something doesn't go back to normal soon, it's time to get checked. A simple scan or a lab test could give you the answers your body's been trying to communicate. A cough that sticks around for more than 3 weeks, especially when you're not sick, deserves your full attention. Most people assume it's allergies, dry air, or leftover irritation from a cold. But when a cough won't go away or keeps coming back, it could be one of the first signs of something deeper, like lung cancer or throat cancer. Even if you've never smoked, even if you feel fine otherwise, a lingering cough that just doesn't resolve is not something to ignore. It might be dry or bring up phlegm. It might be mild or sharp. But if it's regular, and especially if it happens at night or first thing in the morning, your body is telling you something isn't right. Now let's talk about your voice. If you notice it getting hoarser, deeper, or rougher without a clear cause like yelling or illness, and that change lasts more than 2 weeks, it could be a red flag. Cancers of the larynx, thyroid, or even the lungs can affect how your voice sounds before you feel anything else. And if that voice change comes with throat discomfort, pain when swallowing, or ear pain on one side, the urgency increases. The problem is most people wait. They think it'll clear up soon. But early detection is key, and this symptom gives you an early window to act. Don't wait for it to get worse. Don't let it become your new normal. If your voice sounds off or your cough won't quit, get it checked out. It might be nothing, or it might be the opportunity to catch something early while it's still manageable. Finding a lump under your skin can be scary, but what's even scarier is ignoring it. Not every lump is cancer, but every lump deserves to be noticed, tracked, and, if needed, checked out. Many cancers begin with something small, a firm mass in the breast, under the armpit, along the neck, behind the ear, or in the groin area. These bumps often aren't painful. They don't feel like bruises or sore spots. In fact, that's exactly why they're dangerous. They quietly grow while you assume they're harmless. Some people notice them while showering, changing clothes, or resting their hands absent-mindedly. But they wait, thinking it'll go away on its own. If a lump stays the same for more than a few weeks, starts growing, or feels hard or fixed in place, it could be a swollen lymph node or something more serious, like lymphoma, breast cancer, or soft tissue sarcoma. Men often dismiss lumps near the chest, thinking breast cancer only happens to women, but that's a myth. Women sometimes ignore lumps during hormonal changes, assuming they're just part of the cycle. But the truth is simple. If it's new, if it's persistent, and especially if it's changing, don't wait. Get it examined. A quick ultrasound or biopsy could give you peace of mind or save your life. Your hands might feel what your eyes can't see yet. Don't ignore what they find. You don't need to panic, but you do need to take action. Nobody loves talking about bathroom habits, but your body does some of its most honest talking there. Changes in how you pee or poop might not sound like a big deal, but they can be among the earliest and clearest signs that something's wrong. If you're suddenly going to the bathroom more often at night, feeling pain or burning when you urinate, seeing blood in your urine or stool, or struggling to fully empty your bladder or bowels, it's time to stop guessing and start investigating. For men, these changes could point to prostate cancer. For both men and women, it could mean bladder cancer, colorectal cancer, or even ovarian cancer if paired with bloating and pelvic discomfort. And no, it's not just aging or a sensitive stomach. If your stool looks unusually narrow, almost like a ribbon, or is black and tar-like, it could be a sign of bleeding deep inside your digestive tract. If you're straining more than usual, or if your usual rhythm is off for more than a couple of weeks, pay attention. So many people blame food, stress, or travel, and yes, those things matter. But when patterns shift and don't return to normal, that's your internal alarm going off. Don't let embarrassment or uncertainty stop you from getting answers. Your toilet habits are part of your health story. And if you're seeing a new chapter start without knowing why, it's time to ask the right questions. Trust your gut, literally. It knows more than you think. One of the most dangerous things about cancer is that it rarely feels like cancer at first. It often hides behind symptoms that seem ordinary, manageable, or just part of getting older. Things like bloating, back pain, mild nausea, a lingering cough, skin irritation, or frequent headaches, they're so common that we brush them off. We blame stress, poor sleep, aging, bad posture, or even the weather. But that's exactly how cancer stays hidden. It disguises itself as everyday discomfort. That's why so many people don't seek help until much later, when treatment becomes harder and options become limited. The truth is, early symptoms of serious illness are often small and quiet. And if you're not paying attention, you'll miss them. The real key is noticing what's different for you. What's new? What's unusual? What hasn't gone away even though it should have? You don't have to become a hypochondriac or live in fear, but you do have to become more self-aware. You have to trust your instincts and respect the patterns of your own body. If something feels off and that feeling sticks, get it checked. You are the only person who lives in your body every day. That means you're the first to know when something changes. And you might be the only one who notices a warning sign early enough to stop something serious before it gets worse. Early action saves lives. And it starts with paying closer attention to what feels different. We often think of shortness of breath as something that only happens during exercise, panic attacks, or when we're out of shape. But when breathing becomes harder during normal activities like climbing stairs, walking short distances, or even talking, your body could be sending you an urgent signal, especially if this breathlessness comes out of nowhere or is getting worse over time. Chest tightness or a feeling of heaviness that doesn't go away might not be just stress or a pulled muscle. It could point to something far more serious, including lung cancer, heart complications, or cancer spreading to the chest cavity. Some people ignore these signs because they think it's just part of aging or being tired. Others convince themselves it's anxiety. And while anxiety is real and common, it shouldn't mask physical symptoms that are new or persistent. If you're finding yourself out of breath doing tasks that used to feel easy, or if you feel like you can't take a deep breath no matter how hard you try, don't wait. This kind of symptom doesn't always come with pain or dramatic episodes. It creeps in, slowly limiting your activity until one day you realize your life has gotten smaller without you even noticing. Don't let your world shrink while you wait for it to pass. Talk to a doctor. Run the tests. A scan or blood test could reveal something that needs attention now, not later. Your breath is life. Protect it. Some of the biggest health risks don't show up in your symptoms, they show up in your family tree. If you have close relatives who've been diagnosed with cancer, especially before the age of 50, that's not just a statistic. That's a signal that you may be at higher risk yourself. And the danger with inherited risk is that it often gives no early warning signs. You may feel completely healthy while something is slowly developing beneath the surface. Breast cancer, colon cancer, ovarian cancer, prostate cancer, many of these have strong genetic components. If a parent, sibling, or grandparent has had cancer, especially more than one case in the family, your screening schedule should look different. You might need to start earlier, test more frequently, or consider additional types of imaging or genetic testing. But here's the problem. Most people don't know their full family history, or they ignore it, thinking that won't happen to me. Others avoid the conversation entirely out of fear. But knowing your risk doesn't make you weak, it makes you powerful. It gives you the chance to be proactive instead of reactive. Talk to your family. Ask questions. Write things down. Then bring that information to your doctor and build a prevention plan that fits your life. You can't change your genes, but you can change your odds. Ignorance is not protection, and silence is not safety. Know where you come from so you can decide where you're going in health and in life. If you've made it to this point, it means you care. Maybe something in this video hit close to home. Maybe you've been feeling off but didn't know how to describe it. Or maybe someone you love is going through something strange and you've had that gut feeling that it's more than just stress or age. Whatever it is, don't ignore it. You don't need to have all the answers. You don't even need to be sure something's wrong. What you need is to ask. Ask your doctor. Ask for a test. Ask for a second opinion. Or ask me. Seriously, drop your question in the comments right now. Tell me what's been bothering you, what symptom you've noticed, or what story you're carrying. I personally read every comment, and I'll do my best to respond and point you in the right direction. You're not alone in this. Sometimes, just putting your concern into words is the first step to clarity and action. So don't stay silent. Speak up. If something in your body feels different, unfamiliar, or persistent, it's better to check and be safe than to wait and be sorry. And if this video helped you see things more clearly, please consider sharing it. You never know who might need to hear this today. Your voice, your comment, might be exactly what inspires someone else to act. And that ripple could save a life. Now it's your turn. What's your question? Write it below and I'll help you figure it out.